Hi everybody, I'm back today. This video is going to be related to plastics. Why am I talking plastics today is because I got inspired by the few people that are currently doing plastics within the last month, within the last week, specifically targeting Cabernetqueen, Sally, Bandit Stephanie, and intriguingone, Jessica. They all had their surgery within the last month or week, and I wanted, I guess, to give my insight because I'm 2 years out of plastics, and I had a lot of work done. Okay, so I want to start off by saying that plastics is nothing compared to weight loss surgery. If you put plastics and weight loss surgery, there are two different types of surgery. Weight loss surgery, you're out and about within 2 or 3 days. Okay, plastics, oh my God, months of recovery. Seeing these videos lately, it kind of like brought me back into time 2 years ago. A little history on myself. I had a weight loss surgery, Lapand. Got to my goal weight in 8 months. 5 months later, which was a year total out of Lapand, and 5 months after I hit my goal weight, I had plastic surgery done, and I got a whole lot of stuff done. I had gotten a tummy tuck with a little bit of lipo on my sides, and I had gotten a breast lift with breast augmentation. And then from the lipo that they were taking off of my flanks, which are my sides, I had gotten a Brazilian butt lift, which is, injections, fat injections, your own fat injected to your butt. So I had gotten a lot of work done, and I had gotten that all at one time in one day. Okay, so you're talking to a veteran here. Of course, many of you know that I had gotten into huge complications during my surgery. But going back, I remember thinking, which most of you guys are actually experiencing, is the phase where, oh my God, what did I do? What did I do to my body? I had surgery to look beautiful, and it's nothing what you're experiencing. You're going to be with bed rest like within the 3 days or so. You're going to be in a lot of pain. I strongly believe that you're going to, like, when you have plastic surgery, you go into like this depression, okay? Because I experienced it within the first week. It could even prolong and go into 2 weeks. And then, you're not going to have surgery, plastic surgery, and have the results you want right away. I was very inexperienced. I didn't really do like research and go into these blogs and stuff where they're discussing everything they go through. So everything was very new to me. I thought that once I got out of surgery, I was just gonna look in the mirror and be like, ta-da, I'm fixed, this is what I want. No, you're not even gonna be able to look at yourself completely. You're going to be all bandaged up, so you don't even look at your body till like maybe I would probably say 4 days later. Okay, did I not know that I was not going to take a shower within like 4 or 5 days? No. Did I not know that I had to be assistant to go to the bathroom every day for about a whole, I don't know, 5 days? No. I mean, it's very tough. And I think the most, frustrating part about it is that you have these drains coming out of your body that, you have to live with for about anywhere between a week to 2 weeks, And my drains were coming out of my pubic area, okay? And that was very frustrating. And you had to back when I was in Colombia, I had to carry these drains because they didn't give me a pouch to hang them, and then when I had my revision surgery, they did give me a pouch, so I didn't really have to carry them around. and then just the process of them like cleaning them, and like it's just very frustrating. And then like any little movement that you do, you know, you could just like move your drains, or like, you know, it's just a whole lot of things in the process. And then you have to like be aware of like infections, you know, something going on. You know, I hear Sally possibly talking about seromas. You know, I had that, along with other stuff. I mean, I had it all. You guys, you know, you think you have it bad. I had to live with my problems, my potential fatal infections for 3 months straight. My body wasn't corrected for 3.5 months that I had to have revision surgery, you know. And that's when I actually started to see a change. So that meant that I couldn't even wear jeans, okay? I couldn't even wear jeans. I had to live with jogging pants, you know, for 3 months. You know, I had to live with a nightmare. And sometimes too, like when you have plastic surgery, you kind of take it out on people because you're so frustrated all the time. I know definitely I took it out on my husband or my family members, you know. And then, you know, I guess my husband tried to warn me and stuff because my surgery wasn't right. And then I had to deal with, you know, screaming at him, and you know, and then like our marriage was falling apart at the same time, you know, and it was just a complete mess. It was like everything was just like falling apart into pieces, you know. It's like, it's a lot. It's a lot to deal with. So what I have to say to like people is like to really be prepared. If you're really considering having plastics done, it's like a whole nother world. Weight loss surgery is nothing compared to plastic surgery. There's just a whole lot of things that you have to be aware of, you know. You have to be aware that sometimes complications could occur, you know, even in the US. You know, my surgery was out of the US, and of course I paid the price for it. And then I had revision surgery, of course. But even in the US, you could just come up with, you know, complications out of nowhere. And they're just, you know, sometimes it just comes out of nowhere and you have to deal with it. But there is, you know, there's a whole lot of stuff that you really have to deal with. And if you're going to have plastic surgery, just, you know, be prepared with the things that come along, the possibilities that could come along with it. You know, I'm not saying that everybody deals with complication, but a huge number does deal with some kind of complications one way or another, you know, whether it's small, it could be very, very small, or it could be pretty big, you know. There's just things now that I wish I would have known that I didn't know back then, like for me, and I know it's not for everybody. Like when I had gotten my breast augmentation, I had no idea that I was gonna lose sensation in my breasts like forever. You know, it's been 2 years, and I haven't gotten sensation back, and that's something that I wish I would have known. So if I'm thinking, if you know, back then, like if I would have known that, it would have probably played a major part. Another thing that I didn't know is like when you usually have a breast lift with breast augmentation, they will actually do an anchor scar, which the anchor scar is like this and like that, right? I didn't know that, you know. I thought I was gonna have a clean cut, that it was just gonna go like under here. So I have a scar going like this and like this. I didn't know that. When you have breast lift and breast augmentation, you have to have that done as well. So yeah, it kind of bothers me that I don't have sensation. I learned to live with it. Again, that doesn't happen with everybody. Also, I also learned that oh, that's my friend. Just give me one moment. Belk, I'll call you back, okay? Bye. I also learned that during the times that I did have breast augmentation, I had my areolas resized, and if you guys don't know what areolas are, they're your darker part of your breast. So that opened up like a small little portion opened up like on me 2 or 3 times, but eventually it closed by itself, you know. So I was scared shit. I mean, it was like I was going into this like not knowing nothing. And when these things were just like happening to me, and I had a lot of stuff happen to me, when these little things started happening to me, it was crazy. I mean, with when I had my tummy tuck alone, I had like an open track again for 3 months because it had to get revised. So I had fluids coming out of my incision area all the time. Do you know what I had to do? I had to wear pads, Kotex, okay? If not, my jeans would have been like, you know, it would have been wet all the time. So, oh my God, like, you guys have no idea what it is to have plastic surgery and the recovery time. I would say to all of you guys that are having surgery, plastic surgery done, just to be calm, to wait, try to take it easy. Don't rush to see results right away because it's not gonna happen, you know. Another thing that I want to say, when I did my tummy tuck, right, I just did a tummy tuck. I didn't go all the way full circle. I didn't have the 360. Do I wish I did? Sometimes, right? Because I'll get into that in a later video where I still probably have to go for another revision surgery, which I'm avoiding to do, to fix my sides, because I still have like the back, the fat here, which you could probably see in the video. You see, so I have a very flat stomach, and then like I still have fat on my sides that always stick out. So when I didn't do a whole 360 around, you still have fat on your side, you know. Or like sometimes people will go like maybe not a whole 360, but maybe like half of their back. So yeah, that was another thing I didn't know. And then also the scar, it's kind of ropey, you know, so you could feel the scar, and that just stood there for like a year, like almost like for a year, and then it just smoothed out. I'm trying to remember like everything that happened. I was gonna say something about my my tummy tuck, which I think I did. Yeah, that if I would have known, or probably, I'm not too sure if I would have gotten a whole 360 or not. So yeah, there's just a lot of stuff that just goes into plastics, and I just want to say to be patient. You know, you're not going to see results right away. Again, oh, I remember what I was going to say. So yeah, when I had my tummy tuck, I thought that was it. I was going to have a flat stomach, and when I sit down, you know, I was not going to see any rolls, you know, or any fat sticking out. So when I saw that, you know, I was like, what the hell is going on? I mean, a tummy tuck doesn't correct everything, okay? I just want to give you an example. Let's see if we could do it here. I'm just going to sit down, all right? And you could still see fat, you see? You could still see fat, you know? So a tummy tuck, okay, which I had no idea, it's not going to give you perfection. You're still gonna, when you sit down, you're still gonna have still fat, like, you know, like a little roll, you know. It could be the slightest little roll, but you still have something. So I was thinking blind, and I just, you know, I just thought that my stomach was gonna be perfect. I was gonna look like a supermodel, and it's not like that at all. There's always going to be some type of imperfection, something that could always be better, and this is the way it is, you know. So yeah, just be patient with your body. Give yourself at least 6 months to a year for you to actually see the results, you know. Things are not going to happen overnight, not over a day, not over a week, not over 2 weeks, you know. It just takes a lot of time, you know, in order for your body to heal. You have a lot of swelling, you know. Also, when I had plastic surgery done, I even went up a size, you know, in jean size. I mean, I was not even a size 4 anymore. I was a size 6. So there was just a lot of swelling, and it just took a whole lot of time to heal. And that's it, guys. I just wanted to say a quick update, you know, now that I'm 2 years out and I see a lot of you guys having plastics done. It's something to really think about. If you're really serious about it, just be prepared for it. Be ready for it. It's nothing like weight loss surgery. And the mental part of it is very tough. Again, you deal with some sort of, most of the time, like you have postpartum depression after pregnancy. It's kind of like that. When you have plastics done, you go into a small little depression where you was like, oh, I'm in pain. What did I do to my body? Nothing is going to look right. You know, I mean, you have these things hanging out of your body. I mean, it's just a whole mess. So yeah, congratulations to all you guys that are having plastic surgery. This video is not any negativity towards anybody. I just wanted to give like a little insight, you know, nice and slow, patient, steady. And yeah, just be happy and just be patient. It'll get better. And that's it, guys. Thanks for watching. Take care. Bye.